Yeah, these are small little needles that are being placed into axpic scars or acne scars within the face to help increase collagen and contraction. No. When you take off that top layer and you leave the dermis like fully exposed, and that looks like it's a pretty deep, that is interesting. Very interesting. But it's like hitting the lashes, high risk for having issues. I don't see any eye shields that can be concerning, but they could be on the inside of the eyelid, so it's hard to know. This is stressing me out. I have no idea what the heck is going on here. This is literally the wild, wild west. This person's face is being peeled off, and that is not okay. Oh my God, I can't watch it again. Okay, so this is a CO2 laser that was performed on a patient, and several hours afterwards, they were 3 to 4 hours afterwards, they were peeling the top layer of skin off. That is absolutely insane and not something that should be done. And especially, this is a darker skin individual. And so I do have a lot of concerns for the healing process of this person. And let me explain. A fully ablative CO2 laser is a very effective treatment, but I will tell you that it has considerable downtimes, considerable risks, and is not necessarily a treatment that is okay for every single skin type. And the reason that is because it essentially is taking the entire top layer of skin off, and things have to grow from underneath. And unless the post-operative care is really, really precise and effective and really, really well tuned, then really terrible scarring can happen. Because when you take off that top layer and you leave the dermis like fully exposed, and that looks like it's a pretty deep layer of dermis that's exposed, that can just lead to some terrible scarring, terrible infections, and I'm changed the complete complexion of the patient's skin. It can look very waxy. It can look very unnatural. So I strongly avoid ever doing something like that. Gentle chemical peels, a little bit deeper chemical peels in particular areas with good skin tones that have good, healthy rejuvenation is fine with really good post-operative care. Fractionated CO2 lasers are things that I love to perform that work really effectively. It leaves channels of healthy tissue between the tissue, the areas of injury, and that allows things to heal much more naturally, much more quickly, and still give you really good results. So be cautious. Just be cautious out there. This is kind of satisfying to watch, I will say. It's like acupuncture, but to treat scars. Good try. I don't know. Yeah, these are small little needles that are being placed into axpic scars or acne scars within the face to help increase collagen and contraction. No, not really. I mean, I don't think that's going to make a difference. These are areas of tissue loss, collagen loss that causes depression. So when you have acne, cystic acne, or trauma or injury or scarring, you end up getting a valley underneath. And that's because there's a lack of tissue volume. And so, you need contraction of tissue. You need either building up of tissue, you need blending of tissue, but taking like a thumbtack and putting it into a scar and expecting a miracle is, I guess some people are believing in that. I think it's a lot of prayer that is probably going to be the answers for those. So not really an effective treatment. I don't think it's, I don't think you're going to see any improvement unless there's other treatments that are going on outside of this. If they're showing incredible results, then it's not from these thumbtacks that are being placed into your skin. It's likely from lasers, chemical peels, biostimulants, or other types of treatments that can help with acne scars. So not anything effective on my end. Okay. So chemical peel, little micro punches. That is interesting. Very interesting. Not a non-surgical bleph, because that still looks like some sort of surgery or some sort of procedure is happening. But anyway, this is a interesting idea. I think that the chemical peel around the eyes can be very effective. That can help to tighten the skin, that can improve the skin quality and the skin texture. But micro punches of skin I've seen other surgeons actually talk about this, and I think there's some good points out there. It is wildly unpredictable. How much skin are you taking out? Are you taking out a lot of skin? Are you taking out a little skin? Where are you taking it out? There's so many different places that you can take it out. And why are you taking it out there versus another area? The level of predictability of this specific treatment that is being shown here is very, very low when it comes to predictability. And for a procedure that is very, very predictable, like an upper blepharoplasty, which takes out extra skin based on measurements, based on precision, based on calculations, based on anatomy, it is, let's just say, why? I don't think it's necessary. It's like, you don't need to recreate the wheel, but like a broken wheel. You don't need to do that. So this is, if you have extra eyelid skin, you have fullness, this is not a non-surgical treatment. This requires a surgical procedure. 7 to 10 days of downtime, very predictable healing. The incisions heal so well. Easy, awake, in-office procedure. Just do what needs to be done. Don't try to make shortcuts and look for other things out there. So if you got a problem, then get evaluated and get the right treatment. This video is very satisfying. I will give them that. It is a CO2 laser, fully ablative, or almost nearly fully ablative CO2 laser of the upper eyelid. Very close to the lash line, which can be safely done, but it's like hitting the lashes, high risk for having issues. I don't see any eye shields that can be concerning, but they could be on the inside of the eyelid, so it's hard to know, but satisfying, very satisfying. Yeah, so CO2 laser around the eyes, effective treatment, very effective treatment. You got to make sure that, I don't personally like to do a fully ablative laser because I think it can really over treat the skin. It's a very thin layer of skin, and by completely wiping out that top layer, right underneath is the muscle. There's not really a lot of dermis, there's no fat, there's nothing to really kind of camouflage that area. It's really close to the muscle. Typically, it's going to create like a very porcelain appearance and maybe not keep any of like the textural appearance that is actually normal. So yeah, not my go-to. I treat the upper eyelids much more conservatively. I think that the results are much better. If you want tightening, you want improvement in skin quality, I think an upper blepharoplasty with a CO2 laser is very, very effective on its own. I think a fully ablative CO2 laser, just wiping out the entire top layer of skin of your upper eyelid, it's a pass for me. Those are my thoughts on those videos. There's many more out there, I'm sure. So if you have any other videos, leave them in the comments, send them, DM them to me, follow me on Instagram or TikTok, and I'm happy to review those as well. So anyway, nice to see you guys. See you next time at Face the Facts.